The Kaduna State Government has flagged off the mass distribution of medicine for the eradication of bilharzia, also known as schistosomiasis, in the state. The flagged off ceremony was held in Unguwar Shanu Primary Health Care Center, Kaduna. Speaking shortly after the flagged off, the Commissioner of Health, Kaduna State, Hajiya Umma K, Ahmad, who was represented by the Permanent Secretary of the Ministry, Dr. Aisha Abubakar Sadiq, said over 1 million children across the state will benefit from the medicine distribution.
Please do not pay anybody to collect this drug. Your cooperation will ensure that no eligible child in Kaduna State is left behind. As we commemorate today's flag off, we must also recognize, as mentioned by the previous speakers, that it is not just the drug that works to treat schistosomiasis. Countries that have eliminated it have achieved it by improving access to safe water, to sanitation, and hygiene facilities. We must strengthen health education also, and we must encourage positive behavioral change, particularly among our children.
She also applauded the commitment of the Kaduna State Governor, Governor Uba Sani, to improving the health sector through effective disease prevention and control programs. In a remark, the Director of Public Health Kaduna State, Dr. Abubakar Sadiq, said the annual mass drug distribution is a strategy recommended by the World Health Organization to reduce the burden of the disease in endemic areas.
The annual mass drug administration campaign remains one of the most effective strategies recommended by the World Health Organization for reducing the burden of the disease in endemic areas. This year, Kaduna State plans to provide praziquantel treatment to 1,779,625 school-aged children across the state. Achieving these targets will require the commitment and collaboration of every stakeholder represented here.
In his remark, the Algon Chairman, Kaduna State, Sheikh Albani, who was represented by the Chairman Kaduna Local Government, Dr. Madaki, assured of the support of local government chairmen toward the success of the mass distribution across the state.
On behalf of my leader, Sheikh Albani, and Chairman Sabungari, we want to assure you that the 23 local government are going to give their support to this particular program. Both logistic, in every aspect, we are going to support this program to make sure that our children are safe and that they are safe. This medicine or this flag up today represent that Kaduna State is not left behind. And I want to appreciate Site Saver for also collaborating with the state government. And we need more of this collaboration, and we're ready to support you any day, anytime.
Also speaking, a director at the Site Savers, Mrs. Anita Gong, who represented the country director, Professor Joy Shoaibu, expressed concern over the continued prevalence of the disease despite effort by the government and Site Savers and other partners.
We need to promote safe water, hygiene, and personal behavior, because these diseases are caused through waterborne, most of them, and parasite. And then you continue to give medicines, a huge amount of medicines. So I want to appreciate the drug donors, the medicine donors, that they have been consistent supporting us, and the funding from Give Well and Site Savers and Minister of Health.
In his fatherly advice, the district head of Gabasawa, Alhaji Tijjani Bala Muhammad, expressed satisfaction with the commitments of the government and other partners in providing drugs to vulnerable people in the state.
Thank the partners that have participated in providing these drugs, and also call on the state government to explore more avenues in terms of partnering with partners such as Site Savers and others alike, in ensuring that drugs and treatments of tropical diseases that ought to have been eliminated long time ago would be eliminated within the shortest period of time.
She said traditional rulers will continue to support government initiative, especially in the area of health. Highlights of the event was a drama presentation on the negative effect of bilharzia on the human body.
Jawab